Hello everyone. Today, we are going to talk about phobic anxiety disorder, or simply, phobias. And if you still have not watched the introductory video of anxiety, it will be better if you go through it before watching this video. As for a quick recap, anxiety is a feeling of fear about what is to happen, and this is quite normal if we are in a fearful or stressful situation. And, most of the time, it is the body's natural response when we are in stressful situations. On the other hand, it becomes a disorder when we feel fear and anxiety in perfectly normal situations. So, by definition, anxiety disorders are a cluster of mental illnesses which cause significant and uncontrollable feelings of anxiety and fear that can lead to significant damage to the social, occupational, and personal activity of an individual. Anxiety disorders are mainly categorized into three types. They are generalized anxiety disorder, phobic anxiety disorder or simply phobias, and panic disorder. So today we are going to talk about phobic anxiety disorder. Phobic anxiety disorder or phobia is an extremely irrational fear towards a certain object, a situation, or a natural phenomenon. Phobias are categorized into three types. These are specific phobias, social phobias, and agoraphobia. Now let's talk about each of these types of phobias. Specific phobia is when a person is abnormally anxious or shows fear in the presence of a particular object or a situation. And mind you, these objects or situations can be things we see in day-to-day life. And the person knows that the object or situation may not cause any harm to the individual, but he or she cannot control the fear towards it. So, now let's talk about some common types that cause a phobia. These can be animals like spiders, reptiles, or even the least harmful animals like butterflies and ants. And then there are certain aspects of nature like lightning, rain, storms, darkness, and so on. Also, there can be health-related situations that many have phobias. These can be fear of needles, getting medicine, surgery, or even getting ill. And there can be certain situations like flying in an airplane, riding a bicycle, driving a car, going over bridges, or in tunnels. In social phobia, the person shows extreme and inappropriate fear towards social situations. Most of the time a person with social phobia will think that he is not good enough to face a certain social situation and will think that he will be criticized in front of the crowd. These social situations can be a gathering in a restaurant, a seminar, a dinner party, speaking in public, or playing a musical instrument in public. I'm sure that some of us will get very anxious if we were asked to speak or perform in public, and this is quite common. Recent studies have found out that 12% of people from the community show social phobia to some extent. And it is common in both males and females equally. And also, it is said that phobic anxiety disorder is commonly associated with depression and alcoholism. Agoraphobia is when a person shows extreme or irrational fear of entering crowded places, of leaving one's own home, or of being in enclosed places from which escape is difficult. And now, let's talk about the features of a person with phobia. They show the typical features of anxiety when they are faced with a triggering event. Typical features of anxiety, like sweating, palpitations, chest pain, tremors, and fainting are usually observed. And also the person may feel like he is having a panic attack and also feel like losing control of himself. Apart from the features mentioned earlier, there can be symptoms of depression, mostly because of the constant anxiety, and there can be depersonalization. Depersonalization is a state in which one's thoughts and feelings seem unreal or not to belong to oneself. And because of all these problems, there will be marked limitations of the normal lifestyle of the individual. Causes of phobias can be due to genetic factors, psychological factors, cognitive factors, as well as certain neural mechanisms. Treatment methods of phobic anxiety disorders are mainly done by behavior therapy like exposure behavior therapy and cognitive behavior therapy. During exposure behavior therapy, the person is gradually introduced to the stimulus causing the phobia. This has found out to be the most common mode of treatment in phobias. Cognitive behavior therapy seeks to give patients the ability to recognize when their thoughts might become troublesome, and it gives them techniques to redirect those thoughts. Dynamic psychotherapy also has some role in managing patients with phobias. It helps patients find ways to accept themselves, feel safe, and manage their emotions to help regulate potentially destructive or harmful behaviors. And there is medication available to treat phobias. For specific phobia, NMDA partial agonists like D-cycloserine are available to treat patients. For social phobia, selective serotonin reuptake inhibitors like venlafaxine and fluoxetine, monoamine oxidase inhibitors like phenelzine, and moclobamide, benzodiazepines like clonazepam and diazepam, beta blockers like propranolol and atenolol, antidepressants like mirtazapine, and anticonvulsants like pregabalin and gabapentin are given. For agoraphobia, alprazolam, which is a benzodiazepine, antidepressants like imipramine and clomipramine, and selective serotonin reuptake inhibitors like venlafaxine is given.
Hope you enjoyed the video, and don't forget to like, comment and subscribe.